Hi, my name is Asim Ali Qasim, and I work for the Regional Municipality of York, located in Southern Ontario. And right now I'm the acting manager within the Healthy Environments team, which is part of York Region Public Health. So in 2021, York Region Public Health had completed a climate change and health vulnerability assessment. So there were a few key findings that we took from this. Firstly, it showed how complex of an issue climate change and health is, particularly when you look at all the different ways climate change could impact health, direct and indirect, and all the different types of issues you need to think of. Secondly, it also showed that the issues we're facing are not just an issue of the future, but an issue for today to deal with as well. So it showed the need for us to work on this issue now. That being said, when it came to the assessment, we still felt there was gaps to better understand what the community needs were, what the community perspectives on climate change were, and how to better focus our resources to really build a resilient community to the impacts of climate change. So we initiated our HealthADAPT project, which we called Bridging the Gap, engaging York Region residents and stakeholders to build climate resilient communities. As a result of COVID, we had to revise the scope of our work, but we really focused on two key surveys. One was a knowledge and attitudes and practices survey, which was directed at York Region residents, which really tried to get an understanding of the perception of climate change, particularly relating to health. The second piece as well was doing a stakeholder survey. So these were stakeholders that engage with vulnerable populations and would give us some good insight in terms of how we can support these communities in the future, and to make sure those that may be impacted more from climate change get a better chance of being more resilient as well. So the HealthADAPT project really provided us invaluable opportunities to really understand what those impacts are to the community and to better understand our stakeholders. So we're just finalizing the analysis of some of our work, but I can give you some of the preliminary findings we've received when it comes to our knowledge, attitudes, and practices survey. One of the more interesting findings that we noticed for this is that a lot of people aren't thinking that climate change is going to impact them within their lifetime. So I think it showed the need for people to understand how climate change is more of an immediate issue as well. And so that's going to be an important thing for us to focus on in the future. The second piece for us that was really interesting too is how people were feeling very overwhelmed when it comes to the issue of climate change, understandably so. So I think it's very important that we provide a positive angle when we're trying to do promotion when it comes to climate change, showing people can do things to make themselves more resilient. And there are opportunities for that. The other piece of this project that's been really great from the HealthADAPT project is that we've been having conversations with stakeholders that we haven't commonly really spoken to before. And it's really given us good insight into some of those key issues, key opportunities to build bridges. And that's a key issue when it comes to climate change. It's about understanding how we can work better together to really serve the needs of the community. And while we've had our challenges during this pandemic, I think it's been great to see across the board, everybody we speak to really still sees the importance of this issue of climate change. This project has been really insightful to better understand how we can be more resilient to the future impacts of climate change. So in particular, it's helped fill some knowledge gaps, really understanding what the community is feeling, getting a pulse in terms of what the perspectives are when it comes to climate change and health. So it's been really helpful from that standpoint. And secondly, it's also been really good to help start building the bridges and conversations with different stakeholders that are going to be really essential to help some of those that are especially more vulnerable to those impacts of climate change. And I think from this too, we're hoping to learn a lot in terms of how we reach the public. So a big part of what we do in public health at the local level is try to communicate and do health promotion. So we hope that a lot of the findings we get from this will really help us tailor our messaging to be more effective, to make people feel more empowered that they can do more to address the issue of climate change, and to help making sure that they don't feel too overwhelmed as well. After we complete this project, we're hoping to move to the next steps. So following the framework that's been outlined by the World Health Organization, we really want to start honing in a bit more on adaptation planning. I think one of the key things we're going to take away from this project is that we've already started to build those connections with stakeholders. So we want to maintain that momentum and try to see if we can keep engaging those folks, try to learn more about really where we can help those people that are most vulnerable, and also how to just better reach the general public to make sure that we're all more resilient to the impacts of climate change. I think some other pieces too that we're exploring with this project is understanding how to use data better. So one thing we're also exploring is how we can monitor for those impacts of climate change over time, what we can do about that as well in terms of what decisions it can inform. So really exploring a lot of these pieces that will be very integral from a climate change perspective. The last thing I want to say too is that in York Region, we're very fortunate that we also have work being done on a climate change action plan. So our work hopefully will be fitting into that much wider umbrella of how we're dealing with climate change as a whole in the region. Climate change and health is a very complex subject. It takes a lot of time, resources to really delve into it if you're really wanting to look at it holistically and in depth. looking at all the different range of issues, the different variables to think of, it can take a lot of resources to really answer the question really thoroughly. So my suggestions really would be, in the beginning, make sure you scope out the work clearly. Think about really what impact you're hoping to have, what impact you can have within your means and resources, and that'll hopefully help solidify and give you a sense of what the scope should be. I think the second piece to it too is that even though climate change can affect so many issues ranging from extreme heat, extreme weather, air quality, food and water security, vector-borne disease, you don't have to look at all these issues at the same time. You can just focus on a few that you think are priority now. One thing that's been stressed to us, when we look at the frameworks created by the World Health Organization, is that it's an iterative process, meaning that maybe you can tackle one issue now, keep building on it in the future. So I definitely recommend to try to make sure that you get something that's more manageable to target, that can lead to more effective policy and program development. The other piece I just wanted to lastly add is that local picture. I think for us, one key issue with climate change is that it tends to have a lens of either globally or nationally, but we don't tend to have that local impact assessment. So to try to paint the picture and bringing it back locally, I think is really key. And think about what it is that you want to pull from the local information. And I think there's been some valuable things that you can learn at the local level. For example, what impacts urban heat islands may have locally, what impacts flooding may have locally. Those are very local specific questions. So I think there's a lot of opportunities to really delve into at the local level that really aren't highlighted in national assessments or other assessments that cover much broader topic areas.